Jane is a black, single mother living in Mississippi. She is a cashier at Walmart. She makes $9 an hour. She is in the process of studying to become a paramedic while taking care of her 19-month-old son. I just want to take care of him, and I don't think I can take care of a second child by myself, she tells the nurse, in tears. She drove 7 hours to the only abortion clinic in the state of Mississippi after finding out she was pregnant. I feel like a bad person. I know God wouldn't want this for me, but I hope he would understand, she says. Sarah is in a relationship with an emotionally and physically abusive man who is 13 years older than her. They live together in Georgia. She doesn't find out she is pregnant until 2 months in because her cycle was already off due to poor health. When she told her abuser she was pregnant, he was not surprised. She thought he did it on purpose to trap her. Sarah had to call an Uber to get to the clinic because she had no one to take her. If I had my child with my abuser, my child's life would have been broken from the start. That is not fair to them or me, she says. In 2019, 629,898 abortions were reported by the CDC. Roughly 75% of women who seek abortions are low income. While Sarah and Jane's stories do not represent every woman in America who gets an abortion, their stories exemplify the wide range of complex problems women in poverty deal with while deciding to get an abortion or not. Both Sarah and Jane told their stories in 2018. If they were living today, experiencing the same issues, they would not have been able to get their abortions due to restrictions on abortion policy in their states. Since Roe v. Wade was overturned, Mississippi has placed a trigger ban, which prohibits abortion at any stage, while Georgia upholds a 6-week abortion ban. Abortion policy disproportionately affects women and families in poverty, and the lack of access to safe and legal abortion contributes to the stickiness of poverty in America. Therefore, it is impossible to discuss poverty without discussing abortion. In 1973, the United States Supreme Court ruled the right to an abortion constitutional and provided protection under the state in the case of Roe v. Wade. The ruling was determined based on the right to privacy and the Due Process Clause of the 14th Amendment. The ruling declared state regulation of abortion during the first trimester unconstitutional and set over 30 years of precedent. After the ruling, women enrolled in college and entered the workforce at higher rates. One study shows that after Roe, a woman facing an undesired pregnancy early in life was 71% more likely to graduate college than before, and if the woman was black, her chances would increase by 200%. The average age for a woman to get married jumped from 20 to 27, and women's hourly wages increased by 11%. While there was a rise in abortions from 1973 to 1979, the rate has slowly declined since then, reaching pre-Roe levels. It is important to recognize that pre-Roe statistics do not include the under-the-counter abortion cases that were hidden, since they were illegal, whereas the reported abortion numbers in 2016 are more accurate, since they were legal. In 2022, Dobbs v. Jackson Women's Health Organization made it to the Supreme Court questioning the constitutionality of bans on pre-viability abortions. The overwhelmingly conservative Supreme Court overturned Roe v. Wade in a 5-4 decision and held the Dobbs decision, stating that there was no longer a constitutional right to an abortion backed by the federal government. The power returned to the states, causing several states to change their abortion laws. Currently, abortion is legal in 14 states, and various abortion bans are in place in an additional 10 states. In 3 states, abortion is legal but not protected, and in 23 states, it is protected. There are currently 25 million women of reproductive age living in the U.S. in a state with an abortion ban. Knowing who is affected by these bans is one of the most important pieces of information, so we can evaluate what resources they have and what resources they need, in addition to how it is seeping into other parts of their lives. Black women have the highest abortion rate, number of abortions in relation to the number of women, of any demographic in America. They are followed by Hispanic women, then white women. Additionally, 85% of abortions occur for pregnancies out of wedlock, while 15% occur within marriage. A woman seeking an abortion is 4 times more likely to be living in poverty. Most studies that try to determine outcomes of women who decide to get an abortion or not fail to isolate one variable, due to the fact that a woman with a planned pregnancy versus an unplanned pregnancy are in different situations financially and emotionally. The Turnaway study was able to isolate one variable and study how getting denied from an abortion clinic affected their socioeconomic outcomes. This was a 5-year-long study, taking place in 30 clinics across the United States. There were 3 groups of women in the study. The first group consisted of women who received an abortion within the first trimester of pregnancy, considered the control group. The second group was women who were near the gestational limit of 20 weeks but still received an abortion, known as the near limit group. The third group was women turned away by the clinic and denied an abortion because they were barely past the gestational limit, known as the turnaway group. When women were asked why they were seeking an abortion, not financially prepared was the most common response. 47% of the women in the first trimester group were living below the poverty line, while 57% of the later term abortions, group 2 and group 3, were also living below the poverty line. After 5 years, the women in the turnaway group were more likely to be raising children without support from other family members or a man than the women in the near limit group. Women in the turnaway group suffered from lower rates of employment compared to the near limit group after 6 months, but after 5 years, the data was no longer statistically significant. The turnaway group qualified for benefit programs such as TANF, SNAP, and WIC at higher rates than the near limit group, although both groups utilized these programs heavily. Personal income was lower in the turnaway women versus the near limit women within the first 6 months, but evened out over the next 6 years. Since their income stayed relatively the same over 5 years, but the turnaway group's household size increased, women in the turnaway group were more likely to live in poverty, having less money to cover basic necessities and living expenses. The turnaway study shows that denying women abortion rights exacerbates economic hardship that many women who are seeking an abortion might already be experiencing. By passing policy that denies access to a safe abortion, women will have worse socioeconomic outcomes. With abortion bans expanding, women who have the money to travel out of state or the ability to take time off work will continue to be able to get a safe procedure executed. Meanwhile, women who do not have the money or support will be forced to carry out their pregnancies, digging them into a deeper hole of poverty. If mothers who decide they are not in a good situation to have a child are forced to carry out their pregnancies, there will be more children born into poverty and bad situations. Some may argue that more children living in poverty is still better than there being less children, period. By this logic, it could be assumed that people that take this stance would want what's best for children and families after the child is born. But states with the most restrictive abortion policy also have the least amount of child support. Educational opportunity, spending per child, community well-being, and healthcare are all metrics to measure how much states are investing to support children, and states with trigger bans have worse child outcomes and more children living in poverty. Additionally, it is estimated that if mothers gave birth at their preferred time compared to the mistimed births they've had, the children's college graduate rate would have increased by 8%, and their lifetime incomes would have increased by $52,000. So, allowing access to abortion means that a woman can raise a child when the timing is best for her and her child, bettering the child's life as well. Abortion rates are roughly the same in countries where they are illegal versus countries that have them outlawed. Another consequence of abortion bans is that women continue to find ways to get abortions, even though it is illegal, only it becomes unsafe. Across the world, unsafe abortion procedures are a leading cause of maternal mortality, and the United States is too developed of a country to have an increasing maternal death rate, especially if they are preventable. If abortion was banned throughout the United States, it is predicted that the maternal death rate would increase by 24%, while deaths among Black women would rise by 39%. A woman in poverty living in a state with an abortion ban will now have to face a new choice: to keep the baby, even though it will pull her further into poverty, or to put her own health at risk to keep her life on track. Solutions to decrease the number of abortions include providing access to contraceptives and sex education. Low-income women are 5 times more likely to have an unintended pregnancy, while they have sex at similar rates as affluent women, meaning there is a disconnect in the understanding and use of contraception. Affordable child care and paid maternity leave are 2 other ways to help decrease abortion and allow women to keep pursuing their careers while raising children. Abortion policy disproportionately affects women and families in poverty, and the lack of access to a safe and legal abortion contributes to the stickiness of poverty in America. Therefore, it is impossible to discuss poverty without discussing abortion. On the same token, the data presented in this paper supports the idea that reducing poverty may reduce abortions. America's current abortion policy is counterproductive, and we should instead be working to help the poor by making abortion legal, safe, and accessible.